Welcome to the Senior Moment. This is Connie Clark with Home Helpers, and today in the studio with me I have Dr. Tia Flynn. She's an audiologist. Is it that how I say it?
Audiologist.
Audiologist. I always mess up big words. And she is with Affordable Hearing Aids today. And we're here to talk about hearing and seniors and issues like that. So welcome, Dr. Flynn.
Thanks for having me.
This is, for me, this is an unusual line of work. So how did you happen to get into doing this?
Well, my grandmother had hearing loss. Somebody threw a firecracker near her when she was middle-aged and just deafened one ear. And she suffered some loss in the other ear. And she had to wear hearing aids. And, this was a long time ago, and hearing aids weren't very good. So I just watched her struggles. I was in the Air Force, and I didn't really feel like I was helping anybody. I was serving my country, but I wanted a job where I felt like I was helping people. So when I got out of the military, I went to college to become an audiologist.
Interesting. And I bet people that you would see from the military probably had a lot of hearing issues, especially if they were near to where there was artillery going off and that sort of thing, would experience the same type of thing as your grandmother did.
Right. Noise-induced hearing loss, yeah.
So you said back then hearing aids were a lot different, and I remember seeing people with hearing aids many years ago where it was very big, very bulky. You always knew when someone had a hearing aid, and you still had to speak loud for them to hear even though they had one. Nowadays, the technology is they're little teeny tiny things, and sometimes you can't even tell.
Right, they're very, very discreet now. They keep making them smaller and smaller, and I don't know how they do it. But, my grandmother's hearing aid was very large. But for about 50 years, there wasn't a whole lot of change in hearing aids. But in the last, I'd say 20 years, they have made leaps and bounds with technology and going digital and making them really small and discreet. And they even have beautiful colors and designs, and you can have a purple hearing aid if you want one.
Really? I would think it would be a neutral color so people wouldn't see it versus going, here I am,
Well, actually, beige is very boring. We don't even get beige hearing aids for people anymore.
Really?
We match the color of their hair.
Oh, okay.
Typically, just to make it blend in or look like a shadow. So we have all skin colors, all types of hair colors, but the boring old beige hearing aid is out.
Gone by the wayside. I remember seeing them. They were in the back of the ear. I remember seeing something where it looked like something was attached to someone's skull and then through the ear. So yeah, they've gone through all kinds of different changes, and it could be just like a lot of the technology that seniors are using, and us baby boomers are probably pushing it a lot to try to make things more efficient and smaller and that sort of thing.
Right. The one you were describing where it looked like it was attached, it was actually a magnet holding on a hearing device for the cochlear implant.
Really?
Is what you were describing.
What is that?
Well, that's a surgery for the very deaf person or someone that goes suddenly deaf. There's a surgery. They actually drill through the bones of the skull into the inner ear and put an electrode in the cochlea, the inner ear. And then they have the hearing device, which is like a large behind-the-ear hearing aid, which is kind of stuck to the head magnetically.
Oh, okay.
And that's a wonderful, wonderful people that have been deafened.
I didn't even know that. Interesting. Because you see that very rarely. And I usually would see it with a man who has no hair.
Yeah.
But I would imagine there's probably a lot of women out there that have it and you can't tell because their hair is covering that.
Right. Yeah, women's hair covers almost all the hearing aids. A woman's lucky because no one would even know she was wearing one, but a bald man,
Yeah, well,
you're
that's
going to
where
see it.
that's where I'd see it. And then you said that is for when someone suddenly goes deaf and it's totally deaf.
Yeah, or children that are born deaf. But it's just more for people that can't be helped with traditional hearing aids any longer. When their hearing is so bad, they can have a cochlear implant, which is a wonderful thing.
Is that when the parts of the ear have been damaged or don't work any longer? Is that what that does?
Well, you have to have a functioning cochlea. So, and I'm no expert on cochlear implants whatsoever. That's another specialized area of audiology. So I do know that Spokane Ear, Nose, and Throat can do workups for people to see if they have the ear parts needed to make that happen.
Wow, I didn't even know that. Interesting. So let's kind of walk through this, because I know there's all different kind of situations. You've got the folks that were born without hearing, like what we were just talking about, and then you've got people that progressively their hearing gets worse. What kind of things would cause that to happen, other than the firecracker like your grandmother? What would cause someone's hearing to progressively get worse and worse?
Well, it's usually just the anatomy of the ear. So in the inner ear are fragile little hair cells. And as we live our lives, those hair cells start to deteriorate. So by the time we're about 23 is when we usually see them starting to deteriorate slowly, very gradually, so you don't even realize it's happening. But usually by the age of 65, 3 out of 10 of us need hearing aids. So it's very, very common to have a hearing loss just from the normal aging process. But when you throw in all of the rest of life, where you have noises, noise exposure from jobs.
I was just thinking, especially us baby boomers growing up, the concerts and the speakers and the loud bands we used to listen to way back then, that probably did a lot that we didn't even know was messing with our ears back then.
Right. They didn't know what the ramifications were going to be of all that noise exposure. So now we have protections. We have OSHA, where we have standards of you have to wear earplugs or earmuffs if you're in 8 hours of noise over 85 dB every day. You know, there's requirements now to try to save your hearing. But older gentlemen that worked in the mines or logging, all those
factories, that sort of thing.
Factories, the military, aircraft mechanics, jet pilots, all those noisy occupations wreaked havoc on those inner ear hair cells. And so those individuals usually saw hearing loss sooner.
That's interesting, because when you were naming off some of the occupations, I started in my mind thinking all these things like car mechanic. I mean, you've got your head underneath there and you were pushing on the carburetor, revving it up the whole time. I mean, that's loud.
Definitely.
You know, and so there was all kinds of loud occupations that we went through as we grew.
Mm-hmm.
And so that's probably contributing to 3 out of 10 having hearing loss.
Right. And you don't really think about it, but hairdressers with the blow dryer and dental hygienists with the little tools and dentists drilling the teeth.
Way back then, when those were loud.
Well, they're still harmful. Babies in the ICUs, little infants in the when they're neonatal care, those are loud. So there's a lot of things you don't really think about that can be harmful.
So I guess my definition of loud and what your ear defines as loud are probably two very different things. What we think may not be loud at all might be harmful.
Well, I know right now the kids are wearing all those earbuds, listening to iPods and
that you can hear across the room.
Yeah, and I worry even my own son insists that it's not very loud, but I can hear it coming out of his
Right.
ear, and I keep warning him. You can tell kids things, but they just think they're
Invincible.
right. So, yeah, you just don't want those things loud enough and long enough to cause the damage.
So if you're around something for a short period of time that's loud, that's not really doing that much damage, but if it's a prolonged period.
Yeah, it just depends on how loud. So, 85 dB, normal speech is 50-55.
Oh,
So 85 isn't that loud, but if it's 8 hours a day, it can be harmful. So then if you have something that's, 120 decibels, like a lawnmower or, something, I'm trying to think of power tools or something. If you only use it for 15 minutes, it's still harmful, but if you had to listen to it for 8 hours, it's really harmful.
interesting.
If that made sense.
Have they shown, do you know if they've shown any kind of nutritional connection to hearing loss? That I'm just curious if anything has been talked about for that.
Well, I know there's been studies. It's just like anything. You're going to be healthier if you eat right, exercise, and take care of yourself. Good nutrition is good nutrition. If you're not taking good care of yourself, you're not going to hear as good if you're unhealthy.
Because those little hairs would probably go away just like different muscles and parts of your body are because of the lack of nutrition. Now, once someone gets to the point where they think that they're losing their hearing, or their family thinks, because usually it's the family, isn't it, that notices that someone is losing their ability to hear?
Yeah, it's such a gradual thing that the individual themselves usually doesn't realize just how bad it is. It's usually the rest of the family prodding them. Hey, you're not hearing us. You're saying, huh? What? What'd you say? So if your family's telling you you're not hearing well, you really should have a screening.
Yeah, because you're probably sitting there and you keep turning the television up and you're thinking it's normal, and someone else walks in your house and it's blaring
Right.
to them. Because I know my husband. He will have the TV on real loud, and I'll walk in there and go, what are you doing? Why turn it down? But I guess for him, he's thinking that's normal sound. It's not loud to him.
Right. Most people, and with hearing loss, it's a funny thing because there's hearing, listening, and understanding. So they may hear it, but their hearing loss may be to the point where they hear but they don't understand.
Now, are you giving him an excuse?
Yeah. Most people don't selectively listen to the TV, but they will the spouse.
Right, exactly. So I was wondering if you were giving him an excuse here.
Right. So some people hear but don't understand. Some people hear but they're not listening, or they're not paying attention, so they don't understand because they weren't listening or paying attention. So, there's a couple things that we test for when we're doing a hearing test on someone, and a hearing test is different from a screening. A screening is basically going to tell us whether you're a candidate for a hearing aid or not. A full evaluation is going to see how well they understand. So we have, a couple different tests for that.
Do you have the spouse talk to them and see if they understand, or is it, I'm just trying to help me out here now.
Yes. I have what's called live speech mapping in my office, so I can actually sample the spouse's voice right there beside the person with a probe mic next to their eardrum, so I can see what they're hearing when their spouse is talking to them.
Really?
Mm-hmm.
So if you've got a couple that come in and the wife is complaining that he can't hear because he never listens to me or whatever, that you can actually find out what he's really hearing when she's talking.
I can see how, visually see on the computer screen how well he hears her compared to his hearing loss. And then you can compare that to when they actually get fit with the hearing aid.
So maybe it's the tones of her voice
Right.
that he's
right.
not hearing correctly?
Right. Usually, typically, people or men that worked in noise will have a high-frequency hearing loss, which makes it harder to hear women and children. So a lot of people will say, well, I hear men just fine, but I can't hear my grandkids.
Oh, okay.
So, they'll hear the TV announcers.
Because it's probably a male voice.
Right, usually a male. They'll hear them fine. But if the lady's, the weather person is a lady, they might struggle with her. It's a real funny thing how
interesting
you lose those high frequencies, and that affects who you can hear.
And that's if they're around machinery or that sort of thing.
Well, you can get a high frequency loss just from aging too, because the high frequency hair cells are at the beginning of the cochlea.
Oh, okay.
So they become damaged more. The low frequency hair cells are deep down in the curve or the curl of the inner ear. They're more protected.
Is that why when I know my husband has told me if I'm going to yell for something to yell in the lower voice because it travels faster, but probably not that it travels faster, but you could probably hear it better.
Right.
Interesting. Okay, you're getting him off the hook. So I'm going to take a break because I want to continue talking about this because I think this is real important for couples to hear out there, especially if there's communication issues where one says they can't hear or understand the other one. So we're going to take a break and I'll be right back.
So we're still on?
No, this is the part she's going to take off. You can talk. It's okay.
Cough.
You sure you don't want some water?
No, I'm okay. It's just nasty cold.
Yeah, and they hang around.
Yeah, you stumped me with the nutrition one. It's like,
No, I'm okay. No, that's okay. That's okay. You did good. We got through that good. Because
I saw my eyes rolling back in my head.
I've never heard of anything like that either. But when you're talking about things dying in the body, I'm thinking, well, I wonder if there's anything that just came up in my mind.
Yeah.
But you're right. If it's nutrition for your whole body, then it wouldn't be if you take one certain pill, the hairs in your ear won't. You know what I mean?
Mm-hmm. I mean, there's so many things that play in it. Blood pressure and lack of oxygen to the ear. I mean, there's so many things that play into that.
Well, then we can talk about...
No, let's not go there.
Okay, I won't. All right. You ready to go back? Because I want to continue talking about the tones
Sure.
and all of that. Okay, you ready? And we're back. Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and I have Dr. Tia Flynn. She is with Affordable Hearing Aids, and we've been talking about hearing loss and what causes it. And we got started talking about how there are different, what you call them, hairs or fibers in your ear.
Inner ear hair cells.
Inner ear hair cells that actually pick up the different tones of sounds. And the ones that usually die first are the ones that pick up the high-pitched sounds.
Right.
So that if you've got somebody who is saying that they can hear a male voice or something that is a lower tone, they can hear that. But if it's a female or a child or someone with a higher pitch talking, that they can't really hear it. Is it they can't hear it, or it's such that it's muffled that they can't understand?
Well, they're having trouble hearing it because their hearing loss is in the high frequencies. So when they have trouble hearing it, then they're going to have trouble understanding it.
So it might come as a low muffle or a faint muffle?
It's going to sound like people are mumbling.
Okay.
So many, many times patients come into the office and they say, everybody's mumbling. The teachers don't teach kids how to enunciate anymore. And They don't realize it's just their ears. It's their damaged ear. The world is not mumbling. Teachers are still teaching people to enunciate. We don't purposely mumble. It's their ear. So,
and if you've got someone maybe who talks in different tones, the frequency of their voice, depending on their inflection, would either be higher or lower, then that would really cause confusion because they could hear only parts of it. Is that correct? Or
yeah. There's a kind of a graph of where the speech sounds are. And the real high frequency speech sounds tend to be S, F, TH, SH. So you can't really hear very well.
right.
You really have to see that on the person's lips. So a person with hearing loss trying to hear and understand over the phone can be really difficult because they can't see that
They
person.
can't watch the person's mouth moving to know what they're saying.
Right. So it's real important for the person with hearing loss to be directly across from who they really want to communicate with. With or without hearing aids, they need to see that person's lips because they lip read whether they admit to it or not. We get a lot of cues from facial expressions and just our lips forming the sounds.
That's very true. You probably don't even think about it while you're doing it.
Mm-hmm.
But that is probably very true. So as these hair cells die, then the tones that you hear, that you can hear, become deeper and deeper because you can't hear the higher ones, correct?
I wouldn't.
Or your ability to
say
hear
that.
is deeper because the high ones are gone?
Well, you just hear low frequencies better than high frequencies.
Okay.
So you'll hear males, better than females. But you can also have a low frequency hearing loss. It's called a reversed slope hearing loss. So some people suffer from that, and that's a whole different thing. They're almost kind of lucky because most noises of the world are in the low frequencies.
So they couldn't hear something that like a boom, but they could hear a screech.
Kind of like that. More of maybe the refrigerator noise wouldn't be so bothersome.
Okay.
Fans, motors, little things like that wouldn't be so bad for someone with a low frequency hearing loss.
And so then the testing that you do, you can tell by your screening what frequencies they can and can't understand or can and can't hear.
Right. When we put them in the soundproof booth, which is not 100% soundproof, but we try to make it pretty quiet, and we introduce tones into their ears, we go from, I start in the middle, and I go back down, do the lows, and then I go back up and do the highs. And we're going to dial in exactly where you hear and where you don't.
And then you can probably see what the spouse's voice is and see if the majority of that frequency is in the part that they're having difficulty with.
Right. That's where I like having the computer technology of the digital speech mapping, so that I can show the spouse's voice on the screen.
Interesting.
So you can actually see it kind of like an equalizer on a stereo.
Uh-huh. That probably would solve a lot of domestic disputes going on.
I know for a fact that hearing aids can save marriages.
I bet. So when you come in and you find out that someone is having difficulty with hearing certain sounds, does everybody need a hearing aid? Or I would imagine because the different frequencies people are able to hear, that the technology in hearing aids nowadays have to be really precise to pick up those. Is that correct? Or is it just amplifying everything?
No. The hearing aids are designed to amplify where you need it. So if you have a high frequency hearing loss, but your lows are normal, we don't want to amplify your normal areas. We don't only want to amplify the highs that you're missing. Same with like a reversed slope hearing loss. If you have deficiencies in the lows and the highs are okay, we only want to amplify the lows. So
Okay.
the hearing aids are programmed to each person in each ear individually.
Wow.
We really dial them in.
And then my guess being digital, you're able to do that. Are they like computer chips now? Or?
They are little mini computer chips on the back of the inside of the hearing aid, and we hook it to the computer, or we even have technology on the newer hearing aids where we don't even have to be connected to the computer. It just talks to the hearing aid directly, cordless.
Wow.
It's amazing. So we can program the hearing aids to be real specific of where you need help.
Oh my goodness. And so and I would imagine, because as we age, you were saying that these hair cells start dying, a year, 5 years, 10 years down the road, your hearing is going to be different.
Right. Your hearing usually gradually gets worse over time. It's kind of normally it's very slow, but after 5 years, we really need to think about new hearing aids, because your hearing loss has changed enough that the hearing aids may not be powerful enough anymore, or the inner workings of those hearing aids can be just worn out. Just like if you drove a car every day, people don't realize we usually don't drive the car all day every day, but your car is going to need the oil change and repairs. And well, hearing aids, we might wear those 16 hours a day, 7 days a week.
Right.
So there's a lot of mileage on those hearing aids, and they're going to wear out. Eventually they wear out and need replaced. So typically you need to budget for hearing aids every 5 years. And that's hard for a lot of people to swallow because they're costly. But they usually don't sound very well after 5 years.
Well, and if the tones that you're able to hear is changing, and what you were saying was that each one is specifically programmed for that person, then I would say at least the programming would need to be updated, if nothing else.
Right. We continually test for a change in hearing loss and reprogram the hearing aid to keep up with the loss. So we're going to do that periodically throughout the life of that hearing aid, but you really want to change or get new ones every 5 years.
So is that something you would do on an annual basis? Is go in and check to see if that has changed, or not that often?
I typically see enough change to reprogram every 2 years.
Okay. So if you've got a hearing aid, you probably should come in and at least have it checked every 2 years to see if the frequency has changed.
Right. What I like to do is have someone on a plan where I am deep cleaning and checking that hearing aid every 6 months. Sooner if anything's going wrong. If you feel like your hearing aid is weak or not up to snuff, you really need to get in right away. But I like to see my patients at least every 6 months, and then I like to retest, reprogram every 2 years.
Okay. Yeah, I remember having to take my aunt's hearing aids in to get them cleaned. When she wasn't able to hear, that was usually what the problem was.
Right.
Do they still have the little batteries that you have to put in them nowadays with the smaller ones, or?
Well, I did want to talk about extended wear hearing aids while I was here.
Yeah.
But most hearing aids, traditional hearing aids, or daily wear hearing aids, use a battery.
Okay.
And there's about 4 sizes of batteries. And typically you're going to get a week or up to 3 weeks on a battery. Depending on if it's the real little one, you get about 5 days. The largest one, you might get 3 weeks. There's also a newer hearing aid that's been on the market, the last 3 or 4 years, that's an extended wear. It's deeply inserted. The battery lasts 120 days.
Wow.
It's kind of like a contact lens for the ear. It's disposable. It's really, really neat, especially like you were saying earlier about the baby boomers. A lot of baby boomers are very, very active. They're very fit. They're going to the gym. They're swimming. They're just busy, busy, busy. They don't have time to mess with anything. They don't want to mess with anything. So this hearing aid is very, very convenient. You just, I will put it in their ear, deep down in there. And then when the battery dies, we take it out and put a new one in.
So it's not something they'd have to take out if they're water skiing or anything like that?
Well, they can't scuba dive and they can't skydive with it.
Okay. None of that stuff with this hearing aid, but other than that.
They can swim laps above water. They can take water aerobics. They can shower. They just can't swim underwater.
Because of the pressure.
Yeah, they're trying to make it waterproof. Right now it's just deemed water resistant.
Okay. That's interesting. That sounds really neat. And they're probably really, really tiny if you put them in the ear, and then they don't have to bother with them again.
Right. They're very small. They're invisible, and they're really lightweight and soft and squishy.
So just like a contact.
Yeah.
Wow.
They're kind of the wave of the future. That's really the way I see things going.
And then absolutely you would never know if somebody had one on.
No one would know you were wearing those.
Wow. Now, some of the hearing aids that they have, do they have just general hearing aids that make things louder and overall louder?
Just an amplifier?
Yeah.
That's typically your mail order.
That's what I was thinking.
Kind of hearing
and that's
aid.
what I'm thinking she had.
Oh, okay. Well, 50 years ago or 30 years ago, that's all there was.
Right. And there are a lot of people that still might have those, because my mom would put one in occasionally, and I know she didn't go through all of this to find out the exact thing she needed.
Yeah. So there are some real cheap mail order things. I don't recommend wasting your money on those. They usually end up in the drawer. They sound terrible. They just amplify everything in the room the same. So everything seems to be too loud.
And, she used to complain about that things were loud to, they could hear like when you drop something on the floor or something like that. So it was probably that it amplified everything.
Right.
So when you have one of these in your ear that is only particular to your different frequencies, you wouldn't hear things louder. Like I said, even just like dropping something on the floor, it would be loud to her.
Right.
So you wouldn't hear those things because you're only amplifying those frequencies you can't hear.
Well, there's, let me try to explain. If you dropped a set of keys on the counter, that could be pretty shocking. So the higher end hearing aids have some programming where it's like smooths out those really sharp, sudden sounds. It kind of smooths them over.
Okay.
Makes them less bothersome. But most people are seeking clarity. Most people need clarity, not loudness.
Right.
So if you want to waste money on a mail order hearing aid, it's just going to make everything loud. If you want clarity,
makes aggravating.
Yeah, if you want clarity, that's where you need to spend some money and get a kind of a real hearing aid.
That's interesting. I really didn't, sometimes when I start these interviews, I have my expectations of what kinds of things I'm going to hear during the interview. But when you were talking about the one that's like the contact lens, that never even entered my mind that they had that kind of technology out here. And it's still a little computer chip. This still can be programmed like the ones we were talking about?
It is programmable. I have a little computer with a little wand that I stick near your earlobe, and it will reprogram it. If you tell me, things are too sharp or too tinny, I can change it. you also have a tiny remote. It's like a little magnet, a little wand, where you can put it to sleep at night, which puts you back to your normal hearing with hearing loss, so you can sleep. And you turn it back on in the morning, and you also have volume up and down.
Wow.
So it's not just put it in and go. You do have some control, but most people don't need it. Once you program it, you're pretty good. And they're real natural sounding too.
Very interesting. Well, we need to take another break, but I love this conversation. You just have so much neat information. So we're going to take a break, and I will be right back.
Really, for the ears that tolerate it, it's fabulous.
Wow.
It is the baby boomer's hearing aid.
And I've never seen anything like that anywhere on anything.
Oh, you haven't heard a lyric? Keep your eye out.
Okay.
Yeah. Once someone's told you about it, you'll see stuff.
Like when you buy a car, you see the car all the time.
Yeah.
Are you comfortable with going into the conversation about what kind of insurance pays for this kind of thing?
Sure, yeah.
Is that okay to talk about that?
Yeah.
Okay. All right. So I want to talk about that because you've talked about expensive. So let's talk about, does Medicare cover or anything like that? Okay?
Okay.
And this will be our last one.
All right.
So we're doing good?
Yeah.
And we're back. Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and today I have Dr. Tia Flynn with me. She's with Affordable Hearing Aids here in Coeur d'Alene, and we've just been talking about all kinds of really neat technology that is out there concerning hearing loss, and how the hearing aids of days of old, which simply amplified everything, they're still out there, but they're more mail order. That the ones that they have now are more specifically geared to what your hearing needs are and the tones that you can and can't understand. And what you were just telling me about the little teeny tiny almost contact lens thing that is programmable that you can put in people's ears, I've never seen anything like that. That is so cool. And that's the wave of the future. But we've also talked about how certain things, the costs are kind of expensive for certain ones. So what insurance pays for these?
Well, insurance is kind of a sticky thing. If you are a certified audiologist, most audiologists are contracted with Medicare, Medicaid, and most insurance companies. So when we're contracted, we cannot give free, full hearing evaluations. We are required to bill for our hearing evaluation, and everybody is to be treated the same and charged the same. So what I do it is when someone comes in, if they have insurance, I'm going to take a copy of their cards. I'm going to call the 800 number, see if they have any hearing aid benefits, and I'm going to bill for the evaluation. If someone comes in and they say, I don't have any insurance, so I'm assuming they're under age 65 because people over 65 have Medicare. So if they're under 65 and they have no insurance at all, I'm going to do a free screening. The screening is going to tell me whether they need to have a full evaluation or not, whether they're a candidate for hearing aids, if they have an infection, and I'm going to refer them on if they have something that can be medically or surgically treated. But I'll just screen them and let them know if they need a hearing aid or not. If they don't have insurance, then it's, well, do you want to pay for an evaluation, or, what do you want to do? Because I can't give a free, full evaluation. But folks over 65 with Medicare usually have a supplement. So between the Medicare and the supplement, I bill for what they'll pay for the test.
Do you normally see that they cover the entire test, or is there a copay for that, or does it just depend on the plan they have?
It depends on their plan.
Okay.
So sometimes there'll be a $20 copay or a $30 copay. It's usually not any more than that.
Okay.
And then, let's see, Medicaid used to help cover hearing aids, but they don't anymore. They quit July over a year ago. So there isn't a whole lot of help for the device itself. That's usually an out-of-pocket. The person has to pay for that.
And so even on Medicare, they still have to pay for the hearing aid itself?
Yes, Medicare will not cover the hearing aid. Some supplements or other insurances will, so we always want to check for a benefit.
Okay.
So if someone is wondering, they just need to call the 800 number customer service on the back of their insurance card and ask, do I have any hearing aid benefits? Because a lot of people don't know when they have one. I find them all the time. They'll come in, they'll say, my insurance doesn't cover anything, and then I'll call and I'll find a $1,000 benefit, which that's huge.
So what will they usually have, a monetary amount, like a lifetime monetary amount or something like that they cover?
I would say I typically see something like we'll cover up to $1,700 every 3 years, something like that.
Okay. And so then they can just call their insurance and ask those questions.
Right. Now, veterans typically need to go through the VA system. I recommend you go straight there. Don't
do anything with a civilian.
Right.
Okay.
Just go straight to the VA, get a test. They have a fabulous audiology department here in Spokane, top notch, and they'll get you hearing aids if you need them.
Perfect. So if you're a senior and you have Medicare for the test, Medicare will pay for the majority of that. And then you really do need to check your supplement to see if you have a hearing aid device benefit
right
on there. Now, if they don't have a benefit and they were to get a hearing aid device like we were talking about, not the little teeny tiny one that goes inside your ear, but the other one that is programmed to the tones that they can or can't hear, what is the price range that those usually
Okay, so traditional hearing aids are daily wear hearing aids that you put in the morning, take out at night, clean, every day, change the batteries once a week. Those hearing aids are going to be in a range of $2,000 for a pair up to $5,000 for a pair. So, hearing aids are expensive, and you do get what you pay for. And what I mean by that is sound quality. A pair of $2,000 hearing aids aren't going to sound as good at a cocktail party as a $5,000 pair of hearing aids. How it works is there's kind of good, better, best for how you hear in background noise. Because that's the biggest complaint people have is, well, I hear all this background noise. Well, the background noise is typically people talking behind you. It's not really like a motor or an engine or anything. It's other people.
It's not a noise that's not there.
Yeah, it's people that you don't want to pay attention to. Well, the hearing aid is trying to lift voices above motors and fans and things like that. So typically there's directional microphones that help you hear better in front of you than behind you.
Okay, so and you said a pair. Do you always have to wear two, or can someone have a hearing loss in one ear and not the other one?
Right. Each person is, their own, has their own circumstance. So typically there's only 3 reasons why we don't fit both ears. One is if one of the ears are normal. If you have a normal ear, it doesn't need a hearing aid. If you have an ear that is deaf, we don't fit a deaf ear is deaf. We can't help that ear with a hearing aid.
Right.
Or the third reason is if someone cannot afford the other hearing aid.
Okay.
I mean, some people just, they say, I know I need to, but I can't afford it. I can only afford one. So one is better than none, but two typically is best.
Let me ask you a question, because I was just thinking, I used to be on the phone a lot. I was a telephone operator for a number of years, customer service, so I was constantly on the phone, and it was always into my left ear. And so now when you close one ear and listen and close the other, or even when I listen on the phone, I can tell that it's louder when I listen with my right ear than with my left ear. Would you normally see people who have that situation where the cell loss in their ears are different?
Right, I do. I have a lot, and it's mostly women that had a job where they were on the phone and they wore a headset in one ear, and that ear will typically have more damage, so the ears will be a little lopsided.
Yeah, because I was thinking, normal, aging, you would think both ears are going the same, or if you're hearing things, you're hearing with both ears, but I happen to think I do have difference in my hearing from one ear to the other, and I think it's because of that, because I had a headset glued to my head for, hours on end, and that's the only thing I heard those loud voices in.
Sure, that would make sense.
So I'm sure there's probably a lot of other people out there with that same situation. So you might be hearing perfectly fine. 10 years from now, I might still have some good hearing in my right ear, but my left ear, I may not be able to hear anything.
Right. So sometimes we see people that, just need a hearing aid in one ear, but typically the normal situation is both ears are pretty much the same.
So if your spouse is complaining that, they can't hear you, or if you're complaining that your spouse isn't listening to you, maybe there's a really good reason. Maybe the tone of your voice is at that frequency that it's hard for them to hear and understand. So you could go in and get an evaluation done on your ears to find out if that's really the case.
Right. We typically don't selectively listen for no reason.
You're really getting my husband out of the doghouse here. You know that, because he's 65 now, and if there's 3 out of 10, and he grew up in the 60s, and the loud music, and he was in the military down in the machine room of a boat, so he probably does have a lot of that hearing loss and not even realizing it.
Right. He should be screened. We should get a baseline on him.
Okay.
Drag him in.
Yeah, because it was funny. He came back. He said he got a hearing test and he heard perfectly fine. And that was right after I told him something that he really didn't hear, and I told him to turn around and go back because that test was not correct. But maybe it's the fact that they didn't have what my tones were to see that maybe that's what he wasn't understanding.
I wasn't there, so I don't know.
Okay. Well, poor boy. If someone wanted to get some more information about this subject, how would they get in contact with you, Tia? Because I know you do a lot of things for seniors, a lot of outreach for seniors in our community.
Right. I think the most popular thing I offer is Tuesday morning walk-in service. I give free screenings at that time every Tuesday from 9 o'clock till noon. And I wouldn't come any later than 11:30. But my office is at 1601 3rd Street in Coeur d'Alene, and my phone number is 664-2767, and screenings are always free.
And you have a website. It's affordablehearinginc.com.
Yes.
And they can go on there and find out some information. Because this has really been interesting talking to you, because my thought of a hearing aid was simply the amplification, like I saw my aunt and my mother had. And I think it was mail order type things. But they've really come into the digital age with hearing aids in making them a lot more user-friendly, I would say, and more personalized
Right.
to what the
Right.
individual ear needs are. And I'm going to keep my eye out for the little thing they put inside your ear, because I think it's neat you could turn it off and turn it on, or turn it up and down.
Right. It's called the Phonak Lyric, Lyric, Lyric. And you can look it up online. There's a lot of information on it. I would stay away from the blogs because people complain more than they rave about something new. But you just have to try it for yourself.
Very interesting. Well, thank you so much for being on with me this afternoon. I've learned a whole lot of information from you, and I'm going to get him that test so that he has no more excuses.
Right. Drag him in.
I am. Thank you, Tia.
Thanks for having me.
And you all have a wonderful rest of your weekend. Good day.